I have been presenting over, decades, I guess, here, Doheny, and many of the presentations have been about neurotrophic keratitis. So this is really an advancement, or potential advancement, and talking about a very exciting new molecule, recombinant human nerve growth factor. I have no significant disclosures, and let's see what's happening here. Okay. Real quick. Definition, what is neurotrophic keratitis? It is a corneal degeneration secondary to loss or absence of tactile sensation. And we have collected over 300 cases in the process of that. All of them, we have obtained Cochet-Bonnet aesthesiometry measurements and Schirmer's, and what we've identified is that you really have to have profound loss of sensation before you enter into the clinically observable realm of neurotrophic keratitis. Classically, NTK is divided into 3 stages. Stage 1, punctate keratitis. Stage 2, epithelial defect, which is persistent. And finally, the last most dangerous stage, stromal melt. And this is a dangerous disease. You can easily lose an eye to this if it's not properly diagnosed, which I find clinically it is frequently misdiagnosed. And treatment is problematic. A couple of examples of each of these stages. This is a classic stage 1, a mild one. And as I like to teach the residents, this is almost pathognomonic in terms of presentation. There's your punctate keratitis, but it's the location, infracentral cornea. It's almost always this way, especially in a global loss of sensation. Horizontally oriented, and that you will see over and over again with these cases. Here is a more advanced stage 1 following LASIK. Again, infracentral cornea, horizontally elongated distribution. Finally, now we move into more advanced stage, and what we found with our sensations is your sensation is now dropping as you're entering deeper into the disease process. Stage 2, persistent epidefect. This is actually one of our patients that we entered into this study. A zoster neurotropic, required a graft, and there was a lot of actually inflammation associated with this, immune stromal keratitis. Finally, the most dangerous stage, stage 3, and in this case, this is a real bad situation. Emergent, if you will, what you're looking at there is a very large desmetocele. This eye is ready to perf in a very big way. These cases can be treated a number of ways, emergency grafting, but if you don't address the underlying neurotropism properly, this will recur. Our previous treatment options, 2 basic categories, medical and surgical. Medical, bandage contact lenses, preservative-free lubricants, and then you get into a little more exotics, the autologous serum drops, platelet-rich plasma drops, umbilical cord serum eye drops. These don't tend to work very well and or are hard to come by and problematic. Basically not real successful. The surgical category, the classic recommended in all the textbooks is tarsorrhaphy, and it does work. The problem is patients are really reluctant to undergo that. They fight you on it. It is cosmetically very problematic. Amniotic membrane has gained a lot of popularity. I feel that's a temporary solution. Again, the amniotic membrane, when it dissolves, you are right back to square one. You're going to enter into that persistent epidefect or melt problem. So I don't consider this a long-range solution. Conjunctival flaps can work. That will stabilize the eye, but very problematic visual outcomes on these, very poor. Glue, that's really where you're into a pre-perforation or perforation situation. And again, that's only a temporary fix for an extreme situation. You've got to address the neurotropism. What's not on this list put out by Domfe Pharmaceuticals, who sponsored this trial, is something that we use a lot of, and that's very aggressive punctal occlusion. It works very well if you have a pure neurotropic eye. By pure, I mean you don't have an exposure issue, you don't have an immune stromal keratitis issue, which is common in the infected groups, herpes simplex, herpes zoster. That can be very useful. But now we come to something very exciting and new, and I hope this works. These cases are very difficult to deal with. we're going to take a look at nerve growth factor, an overview and clinical evaluation of that. It is a pleiotropic, if you will, molecule, meaning it has multiple or diffuse effects. It is present in the central and peripheral nervous system, present in the immune system, present in the blood, the heart, the liver, the salivary gland, and when you get to the eye, multiple portions of the eye, the cornea, the aqueous, the iris, the retina, and the optic nerve. It expresses biologic activity on the central and peripheral nervous system, the immune system, and the endocrine system. This makes it a potential useful treatment for a broad spectrum of degenerative diseases. A little bit on the history or background of nerve growth factor and the visual system. Back in 1991, nerve growth factor was found to induce neuronal differentiation in the retina. 1993, we first start to see the name lambiase, and he's really the driver behind this molecule and the evaluation of it. It was identified that nerve growth factor protects retinal ganglion cells from trauma, ischemic events, and hypertensive damage. Then in 1996, again, lambiase, nerve growth factor delays retinal degeneration in retinitis pigmentosa animal models. And finally, in 1998, which was really kind of a landmark paper, New England Journal of Medicine, lambiase published the effects of nerve growth factor on the ocular surface and the successful use of this agent in neurotropic patients, and this is just that article. We're going to cone down now to the ocular surface. Nerve growth factor and nerve growth factor receptors are expressed by the ocular surface. Nerve growth factor induces proliferation and differentiation of the corneal epithelium. Also, corneal fibroblasts are differentiated, affecting their migration and contraction. NGF modulates corneal innervation. It can also modulate immune reactions, potentially making it used for immunologic corneal disorders like Morin's ulcer. It modulates tear function, dry eye, modulates epithelial healing in vivo. Now, up to this point, all the nerve growth factor I've been talking about and that was utilized in these studies was obtained from the mouse, submaxillary glands. This made it very difficult to obtain large amounts. It was extremely expensive, and therefore, with the successful use of this agent and its promise, efforts were made to engineer it in higher quantities, and that's where Domfi Pharmaceuticals, it's an international pharmaceutical company headquartered in Italy, began that process. NGF is a small protein, only 118 amino acids, but it has a fairly intricate and complex structure and bridging, which makes engineering this difficult. Domfi has developed a successful engineering process, which is proprietary at this point, making available quantities, allowing us to enter into clinical trials. Now, this is a breakdown graphic, if you will, of all the different areas where nerve growth factor is actually being looked at in clinical trials. First on the list is the neurotrophic keratitis, which I'll go into detail in just a moment. But it is also being evaluated for dry eye, and actually clinical trials are in progress in this realm. The interim data on this shows safety and tolerability in the phase 1, and there's a phase 2 interim data showing significantly improved Schirmer scores, significantly improved staining scores. I think this is really interesting, and that dry eye is now recognized as such a common disease. And in reflection of that, how commonly we see it, understand, if you don't know this, Restasis, the long-range treatment for dry eye, is currently the #1 selling ophthalmic product in this country. So this is a big area of potential clinical impact. We can also move into the posterior segment. I mentioned all those ocular structures and tissues that respond, that demonstrate nerve growth factor. There are currently in Italy ongoing clinical trials studying retinitis pigmentosa. In fact, they should be wrapping up, if not wrapped up around this time. I haven't heard any data from those studies yet. And finally, in the realm of glaucoma, for the glaucoma folks here, there is a clinical trial being constructed here in Southern California, Shiley Eye Center. Jonathan Goldberg is going to be looking at that. At least that's being put together. Very exciting. Let's focus in here, the last part of my talk, clinical trials for neurotrophic keratitis here in the United States. The investigational product is the recombinant human nerve growth factor at a concentration of 20 micrograms per milliliter. It's formulated in a topical, sterile, isotonic, antioxidant solution utilized at installation 6 times a day. This trial, phase 2, 8-week study, multi-centered, randomized, double-masked, vehicle-controlled, parallel group study with 24 or 32-week follow-up periods. Trial description, the target enrollment nationally was 48 patients. What they were trying to do is get about 5 per site. There were 11 sites in the U.S. We had one at Loma Linda. UCLA had one under Sophie Dang as well. They also had a confocal system there. So there were 2 sites in Southern California. The subjects randomized on a 1-to-1 drug versus vehicle setup. The study population, we were looking for adults with stage 2 or stage 3 neurotrophic keratitis. They had to have a lesion, i.e. a persistent epithelial defect or stromal melt for at least 2 weeks prior to entrance into the study. That lesion had to be refractory to conventional non-surgical treatments, including preservative-free artificial tears, gels, or ointments. They had to be refractory to the discontinuation of preservative-containing medications, which can very much affect the healing of these lesions, and finally failed bandaged soft contact lenses, any of these parameters. Finally, all patients were tested, quantitated in their corneal sensation with the Cochet-Binet aesthesiometer, requiring a reading of less than 40, normal being about 45 or higher millimeters. I'd make a comment in our studies identifying clinical neurotrophic keratitis. The average sensation in our large group of patients is about 5, and there is your profound loss. The primary objective of this study was to evaluate the efficacy of recombinant nerve growth factor for complete healing of stage 2 or stage 3 lesions. Secondary objectives was to assess the duration of that complete healing, what improvement, if any, in visual acuity, and finally to document in serial fashion the change in corneal sensation. Trial status at this point, all 48 patients have been enrolled, so there is no more active enrollment at this time. The follow-up data is still being collected. We have a tail end. Patients entered the last part of the study a couple of months ago are still being processed on their data. Interim data lockdown has been performed, but the final analysis is still pending, and I regret I cannot give you any outcome at this time. I've been calling the company all week trying to pry that information out of them for you at this meeting, and they will not release it. I even offered a small check. It didn't work, okay? Any rate. So in concluding, neurogrowth factor actually I think is a very exciting potential treatment modality, an interesting molecule with multiple actions on ocular structures, with potential for use in a variety of diseases, dry eye, ocular surface diseases, stromal diseases, immunologic-mediated corneal diseases, and retinal disorders. It would be very exciting to see what comes of the glaucoma studies. A variety of other studies may be emerging from this, but bottom line is we may have a very exciting new modality in terms of treatment to offer our patients across a spectrum of degenerative diseases. Finally, in honor of our guest speaker from Bascom Palmer, I'd like to present a knockoff of Key Biscayne, okay? This is actually sunset where I live, San Diego, on a Santa Ana wind day. That's all smog from LA that gives you those beautiful colors. We appreciate that down there. Thank you very much.
you.